So after discussing the erectile dysfunction and what is erectile dysfunction, what is the pathophysiology of erectile dysfunction, in this section now let's discuss the treatment of erectile dysfunction. In the treatment, we will talk about the patient education, some oral agents that can be tried for the treatment of this disorder, androgen therapy, vacuum constriction devices, surgery, sex therapy, and some other methods of treatment for erectile dysfunction. So first, the patient education. Patient education is very, very important in this step. Maybe the issue is only psychosocial or psychological, and sometimes just talking or educating the patient can solve so many problems. So facilitate understanding of disease, results of test, and selection of treatment. So when you talk to the patient, educate the patient, you should tell them what this is and how you are planning to treat the condition and what are the different tests you will do for the patient. Discussion of treatment options. High risk lifestyle issues. If there is high risk lifestyle issues that are associated with condition, you need to discuss those with the patient. Oral agents, some oral agents that can be tried for the sexual dysfunction or erectile dysfunction specifically. We have the approved drugs include sildenafil, then we have tadalafil, vardenafil, and avanafil. All these are the approved drugs used for the erectile dysfunction. All these drugs used for this, and this cause a negative effect on the phosphodiesterase 5 PDE5, and it can cause the L-arginine have cause increased nitroxide level. Sometimes they say that it can increase the nitrous oxide level to very, very high levels that can be dangerous, but this increases nitrous oxide, then that increase cyclic GMP. Cyclic GMP cause decrease in the calcium level. There is relaxation of the smooth muscle, and there is erection. So drugs used for this, as we talked in the previous slides or previous section, that the pathophysiology that is involved is the production of nitrous oxide by the parasympathetic nervous system stimulation, and that nitrous oxide causes the change of cyclic GMP formation, and there is decrease in the level of calcium that causes smooth muscle relaxation and more dilation and pouring of the blood and leads to erection. So the drugs that are effective for this erectile dysfunction affect on the same pathophysiological mechanism and cause the treatment of this disorder. But sometimes the production of nitrous oxide is so much with increase with the drugs that it might be dangerous. So that's the oral agents that are effective for this erectile dysfunction. Then the androgen therapy. Androgen therapy is like testosterone replacement therapy. Testosterone is the main male hormone, male sex hormone, which causes different changes and the growth in the male. So we have, this is the brain, then we have pituitary gland. From the pituitary gland, there is production of luteinizing releasing hormone. This luteinizing releasing hormone causes production of testosterone by the testicles. So if this is not effective, then the replacement therapy is required to treat this condition. Androgen supplementation can be transdermal patches and gel oral preparation, both are available. Adverse effects are gynecomastia. If there is excess androgen therapy, it can cause gynecomastia. Gynecomastia is the enlargement of breast tissue in the males. So gynecomastia, it can cause sleep apnea, difficulty in breathing during sleep. It can cause development or exacerbation of lower urinary tract symptoms or BPH, benign prostate hypertrophy, prostate cancer, lowering of high density lipoprotein, erythrocytosis, increased level of red blood cells, and elevation of liver function test. So all these are different adverse effects that are associated with androgen therapy or the replacement therapy of the male hormones. Reduced fertility is also there. So these are some adverse effects that are associated with the androgen therapy to treat the erectile dysfunction. Vacuum constriction device, that's the vacuum constriction device which has attached to handheld pump, and this is the cylinder and this is the compression ring. This causes the compression and constriction. It's a non-invasive therapy. Draw venous blood into penis. So it causes contraction, constriction, compression, and draws the blood into the penis and cause erection. Use a constriction ring to restrict venous return and maintain tumescence. Adverse effects include pain, numbness, bruising, and altered ejaculation. Intraurethral alprostadil. This is the instrument used for the intraurethral. Inside the urethra, medicine is injected. This is the button of the device. Then we have the body, collar, stem, and this is the medicated palate. Intraurethral prostaglandin E1, which is alprostadil in the form of semi-solid pellet, doses of 125 to 1000 microgram is delivered with an applicator. So prostaglandin is given with the help of applicator into the urethra to try to relieve the erection problem. So this is the applicator that is used, and it has a medicated pellet inserted into the urethra. Intracavernosal self-injection. Here self-injection is vasoactive substance is injected into the corpus cavernosum and dorsolateral location of injection site. So in this, the injection is given in the corpus cavernosum, and this can doses range between 1 and 40 microgram. Contraindications are hypersensitivity to drug and men at risk for priapism. So this is another method for the treatment in which self-injection is given, and that can cause the changes in the blood vessels and the cavernosal tissue and helps in the erection. Side effects, local effects might be prolonged erection, pain, and fibrosis with the chronic use. Surgery, this is the inflatable penile prosthesis. So surgery is performed in which there is a penile prosthesis and it's inflatable we can inflate. This is the fluid reservoir, and this is the pump which is prosthesis or inserted in the scrotum, and this is the inflatable cylinder here. This is deflated right now, but once it's inflated, this causes erection. This is the metallic semi-rigid implant, and this is the after it's downward, but once it's inflated, it causes erection. So this is the prosthetic surgery performed to treat this erectile dysfunction in the males. Sex therapy for addressing specific interpersonal factors, in session discussion and at home exercises. Psychosexual therapy, sensate focus, sensory awareness exercises, correction of misconceptions about sexuality, interpersonal difficulties therapy. So this was the treatment of erectile dysfunction, in which we talked about the oral treatment, and then we talked about some other surgical methods, and also the therapy for the treatment, and discussing different issues that can treat the patient. Thank you for watching sqadia.com.